And warm temps? Yes, ma'am.
I'm trying to stay alive till Thursday. All right, 6:47.
The CDC is updating its guidelines for prescribing opioids for chronic pain, citing new research on alternative treatments.
Here's what Natalie Rivera, a certified recovery specialist, says about opioid addiction in this country.
A lot of them are starting out with prescription drugs. They were hurt, they had an accident or surgery, and that's how they get addicted.
Yep.
So we want to bring in Dr. Mike to talk about these changes and what this will mean.
Well, Mike and Alex, this has been a very contentious issue for many years since the guidelines originally came out in 2016 or so. Bottom line is that, yes, we don't want to use narcotics if there are other options. And that still is in these new proposed guidelines. Use things like ibuprofen, Motrin, acupuncture, massage, anything, even things like gabapentin. We use these types of drugs that are much less risky and much less addictive than narcotics. But the point is that there are some people who have significant pain that have been collateral damage, if you will. They have suffered because they can't get narcotics because of these strict guidelines. So what they're trying to do is to make it more individualized and give people like me the opportunity and the choice. Is this someone that does need narcotics? But it's got to be done very carefully, methodically, and in a scientifically based way.
Yeah, in a one-on-one way. Hey, Dr. Mike, I was reading about Bob Saget again. Can you have multiple fractures to your head and not know it?
I can't believe that. So if you look at the autopsy report findings, and again, I have nothing to do with this personally, but he had fractures, multiple fractures going from the back of his head all the way forward with bleeding on both sides. Now, you mean to tell me that if you fall in the shower, you hit your head that badly that you're just going to say, well, I'll take a couple aspirin or I'll just go to sleep. I've had patients with fractures like this, and they are in a bad way. It just doesn't make sense to me. I don't know what happened, but it was a severe, significant trauma to his head.
Yeah.
So I guess,
very significant.
Because the notion at the beginning was he just, oh, it must have been nothing and just went to sleep. So now you're saying that maybe something else could be at play here?
If you fracture your skull, that amount of trauma, you're not going to feel well. I mean, you're going to end up in an emergency room or some. I mean, the patients that I've taken care of with fractures of the skull invariably end up in an emergency room. So I just don't get this. There's something funny about it.
We'll stay on it.
Doesn't smell right.
Hey, what's happening over at Penn? They're making up their own concoction of a vaccine?
Well, they're working on it, and that's what we do here. They're coming up with a lot of different options when it comes to vaccines. Remember, this messenger RNA technology was originally developed about 20 years ago right here at the University of Pennsylvania. Very proud to be part of the action here, and they are continuously looking for different kinds of vaccines and how we can use that technology to better a number of diseases, not just COVID.
When they get it finalized, I've gotten word that the nickname for that particular vaccine is going to be the Mikey, after Dr. Mike.
Oh, is that it?
Yeah.
Yeah.
Did you get the Mikey Spike?
I was hoping for at least a bathroom named after me someday. That's what I was hoping
A bathroom?
for.
Well, high
That would be
ambitions.
an honor.
Yeah. I want to have something named after you.
Thank you, Dr. Mike. We'll see you later this week, I'm sure. 6:51 now.
So as you know, the Sixers